Hi there, and welcome to the OncoBuddy podcast, your trusted source for insights on cancer care. I'm your host, Ms. Gayatri from 4-Base Care. In each episode, we explore different aspects of the cancer journey, providing valuable information to help you along the way. Today marks the 8th episode of our podcast, and we are so glad you're here. If you haven't already, make sure to subscribe to the OncoBuddy podcast so we can continue this journey together. We have a special episode lined up for you today, focusing on two crucial aspects of cancer care: managing weight during cancer treatment and the importance of addressing comorbidities. We'll also be answering two intriguing questions from our OncoBuddy app users, questions you won't want to miss. Joining us today is Sharmila, a senior onco dietitian at 4-Base Care. Welcome to the podcast, Sharmila.
Thank you, Ms. Gayatri. I'm thrilled to be here to share my insights with your listeners.
Starting off our podcast with the most frequently asked question or common doubt emerging in all cancer patients. What are some common challenges cancer patients face in terms of weight management, and how can they overcome them? Do treatments like chemotherapy or radiation really impact a patient's appetite and nutritional intake?
Absolutely. Weight management during cancer treatment is a significant challenge, and it's something that many patients struggle with. Common challenges include appetite loss, nausea and vomiting, taste changes, difficulty swallowing, and metabolic changes, all of which can impact nutritional intake. For example, treatments like chemotherapy and radiation often lead to a reduced appetite. To counter this, eating small, frequent meals instead of 3 large ones can help. Incorporating high-calorie, nutrient-dense snacks can ensure sufficient calorie intake even when appetite is low. When it comes to nausea, which is another common side effect of chemotherapy, bland, easy-to-digest foods like crackers, toast, and bananas can be helpful. Ginger tea or ginger chews are also known to elevate nausea, and of course, anti-nausea medications prescribed by a doctor can be very effective. Many treatments also alter taste, making certain foods unappealing. I suggest experimenting with different flavors and seasonings like tart flavors like lemon, or adding herbs and spices can sometimes improve taste. For those who have difficulty swallowing, especially after radiation therapy for head and neck cancers, pureed or soft foods and nutritional shakes are easier options. It's important to consult a dietitian for personalized advice in these cases. Lastly, cancer treatments can alter the body's metabolism, leading to unintended weight changes. So, regular consultation with a dietitian can help tailor a nutrition plan that meets the patient's changing metabolic needs, ensuring that their protein intake is managed effectively, because protein is crucial during cancer treatment as it plays a key role in the body's repair processes.
Wow, Sharmila, that was incredibly insightful. It's clear that managing weight during cancer treatment comes with its unique set of challenges. But with the right strategies and support from a dietitian, patients can navigate these hurdles more effectively. Now, shifting gears a bit, let's talk about another significant aspect of cancer treatment, that is, dealing with comorbidities. Nowadays, many patients not only battle cancer but also manage other health conditions simultaneously. This brings us to our next question. What adjustments need to be made in a cancer patient's treatment plan when they have significant comorbidities?
So, managing cancer in patients with comorbidities requires an individualized approach. The adjustments include a thorough review of the patient's medical history, including all existing comorbidities, is very much essential. Chemotherapy may need to be adjusted to reduce the risk of aggravating conditions like heart diseases or diabetes. Sometimes less aggressive treatments or alternative therapies are considered to minimize the impact on comorbid conditions. Developing nutrition plans that address both cancer treatment needs and comorbid conditions is also crucial. For example, a low sodium diet might be necessary for someone with hypertension, while a carbohydrate controlled diet could be essential for managing diabetes. Additionally, frequent monitoring of blood glucose levels, kidney functions, and overall health is very much necessary to quickly identify and manage any complications.
That was incredibly informative, Sharmila. It's clear that managing cancer in patients with comorbidities requires a tailored approach to address both cancer and the existing health conditions. Now let's dive into a question from our community on OncoBuddy app that often comes up. Many people think salads are always a healthy choice, but I've heard they might not be the best option during chemotherapy. Can you explain why it's often recommended to avoid salads during this time?
That's a great question. While salads are typically healthy, there are specific reasons why they might not be recommended during chemotherapy. Chemotherapy can significantly weaken the immune system, making patients more prone to infections. Raw vegetables common in salads can sometimes carry harmful bacteria or parasites that could lead to foodborne illness. Additionally, chemotherapy often causes gastrointestinal side effects like nausea, vomiting, and diarrhea, as we discussed earlier. So, raw vegetables can also be harder to digest and might aggravate these symptoms. High fiber foods like raw veggies can also increase the bowel movements, which might be problematic for patients already dealing with digestive issues. Mouth sores and sensitivity, which are also a common side effects of chemotherapy, can actually make eating rough or crunchy foods uncomfortable. So soft cooked vegetables are easier on the mouth and digestive systems, and cooking also helps kill potential pathogens, reducing the risk of infection. This is why it is recommended to avoid salads during the therapy.
Thanks for clarifying that, Sharmila. It's so helpful to understand why certain food might not be recommended during the treatment. Now, being here with you in each of the podcasts has improved my knowledge in the area of cancer treatment and its side effect management. And I can see how important an onco diet is and the role of onco dietitians are. I hope the query has been answered and our listeners have gotten their answer. Another query we often receive is about the protein intake. Many cancer patients struggle to get enough protein during the treatment. Could you share a simple and delicious protein-packed snack recipe that could help them meet their nutritional needs?
Absolutely. One great option is paneer tikka, a flavorful and protein-rich snack that's easy to prepare. So to form a marinade, in a bowl, mix yogurt, gram flour, ginger garlic paste, turmeric, red chili powder or pepper powder, garam masala, cumin powder, coriander powder, lemon juice and salt. Add the paneer cubes to the marinade and mix gently to coat. Let it marinate for at least 30 minutes. Grill or bake the marinated paneers for 10 to 15 minutes, turning occasionally until the paneer is golden brown. Serve hot with mint chutney or a side of yogurt. So coming to the nutritional benefits, paneer is a great source of protein and calcium. The spices used here can aid in digestion and have anti-inflammatory properties. Another excellent option is moong dal chila, also known as savory lentil pancakes. So coming to the instructions, drain the soaked moong dal and blend it with ginger and a little water to make a smooth batter. Pour the batter into a bowl and add turmeric powder, cumin seeds, salt and chopped coriander. Mix it well. Heat a pan, grease it lightly with oil and pour a ladle full of batter onto the pan. Spread it in a circular motion as you do for dosas. Make a thin pancake. Flip and cook the other side until it's done. Remove from the pan and serve hot with some yogurt or mint chutney. Sure, it will taste yummy. Coming to the nutritional benefits here, moong dal is rich in protein and easy to digest. The dish is also high in fiber, which aids in digestion. These dishes are not only nutritious but also easy to make, making them great options for meeting your protein needs during the treatment. I hope these two recipes will be sure useful to our listeners.
I'm sure our listeners will love these recipes. Thank you, Sharmila, for sharing your expertise with us today.
Thank you so much, Gayatri, for having me here.
And to our listeners, thank you for tuning in to the OncoBuddy podcast. Don't forget to subscribe for more informative episodes. To stay connected with dietitian Sharmila, download the app from Google Play Store. The app offers various sections including Onco Hub for expert advice, Onco PHR to manage your medical records digitally, and Onco Consult for virtual consultation with oncologists, dietitians and psychologists. Explore more by downloading our app today. Until next time, take care and stay healthy. Together we beat cancer.